Good morning from Clinic School Press. We are excited that in October of 2025, the Pediatric Illness Classroom Survey, or PICS, was finally released for public sale. If you serve at an outpatient specialty clinic located at a children's hospital or as an office-based psychologist with a pediatric subspecialist practice, this video is for you. PICS can simplify your life as it enhances the understanding and quality of services delivered to your patients. This statement from the American Academy of Pediatrics is one that most pediatric psychologists, as well as clinical neuropsychologists who work with youth, can endorse. We would argue, however, that psychologists require not only experience and expertise, but also the proper tools. We would also contend that psychopathology-centric behavior rating scales are not well aligned with this particular task. However, PICS is. Here's a situation that may ring familiar. You are present in a specialty clinic for diabetes, epilepsy, or hemophilia. A subspecialty pediatrician is also present in the same room. Alternatively, you may be in a nearby office, summoned only when needed. The topic turns to school. You concur with the AAP statement that educational information is essential, but you lack a systematic and trustworthy method of collecting it. Parents can offer anecdotes that may share too much or too little. Whatever is shared is inherently secondhand. This is where PICS can prove invaluable. A bit of background. PICS authors comprise a diverse team. 4 of us have worked in various pediatric clinics, 3 at Phoenix Children's Hospital, and 1 at Penn State Hershey Medical Center. 4 of us have worked in schools as teachers, school psychologists, or school nurses. We each brought our own unique experience and perspective as we constructed the 44 items that constitute the PICS answer form, and the 80 pages of manual guiding how to use PICS. We also bring what we have learned from research. We know from our own research on conditions like cancer, type 1 diabetes, sleep problems, epilepsy, and hemophilia where the greatest on-campus vulnerabilities lie. In the PICS answer form, you will find 44 items distributed across these 5 sections. The items and the manual were constructed over a period of years by our team of school psychologists, neuropsychologists, pediatric psychologists, a pediatrician, and a school nurse. PICS has 4 uses. This video is an overview of 2 of them. As you might guess from prior comments, the first is simply to screen. But let's drill down for some necessary details so you can see how screening is facilitated. Items are arranged with options indicating increasing teacher concern. There are subscripts to help with structured interpretation. There are also red flag items that indicate the student's health team should probably be notified. 8 of these medical notification items relate to loss of function that could have a medical origin. For example, loss of cognitive, motor, or language function would be considered a red flag. 3 other medical notification items relate to problems getting work done because of one of the following: lethargy or drowsiness, nausea, or pain. Teacher endorsement of these items could indicate poor control of symptoms or medication side effects that the prescriber would want to know about. Again, generic behavior rating scales do not inquire about these possibilities. Regarding notification, of course, if you're in a clinic where the team members are face-to-face, it's easy to mention such a finding. If it's asynchronous or if you're in a different office, you would probably reach out to the prescriber or specialist. PICS is criterion referenced. It is not norm referenced. This method was selected after much debate and for technical reasons that we won't go into here. Typically, each clinic team should create its own threshold level or criteria and then implement it in a case-by-case manner. Variations in the level of resources coupled with treatment philosophy will create differing criteria denoting a failed screening. The first step requires at least one person, like a psychologist, with measurement training. The second step might sometimes be handled by a nurse or social worker or somebody without formal training in measurement and assessment. It's up to each clinic to decide. The manual describes how to do all of these things in detail. The manual also includes many case examples. Furthermore, there's an Appendix E that provides 2 reproducible forms for establishing criteria and guiding implementation case by case. It's not a great leap to see how PICS could not just be used to screen, but also to monitor change. Consider a hypothetical. Among your responsibilities is the sickle cell clinic at a regional children's hospital. You're consulted about a 10-year-old patient, Jenny Sanders, who has suffered a stroke in the left cerebral artery with resulting aphasia, right hemiparesis, and a remarkable pattern on neuropsychological testing. Jenny is transferred to inpatient and then outpatient rehabilitation. On her initial return to school, PICS is able to document diverse problems in language, reading, and writing. Her hematologist asks you to be of service to her parents, who are concerned about recovery and her successful reintegration into school. You treat Jenny's 3-week post-stroke status as her baseline and re-administer PICS every 2 weeks. Because Jenny was encountering problems on most of the skills and capabilities tapped by Section A, a strategic measurement decision was made. All 13 items, each rated on a 0 to 4 basis, would be tallied using the subscripts. The item total, ranging from 0 to 52, could thus serve as a numerical indicator of Jenny's current classroom status. The figure depicts her recovery trajectory at school. Together with a second neuropsychological evaluation, it also helps inform whether her 9-week post status indicates sufficient improvement to curtail rehabilitation in lieu of school-based supports. Not just recovery, but also ongoing decline can sometimes merit monitoring. Perhaps Jenny Sanders with sickle cell endured not just a single stroke, but more than one. For her, as well as patients with late effects, encephalopathies, autoimmune conditions, and many other conditions, their neurocognitive development might slow, as expressed by a flattened trajectory, or even decline. The same is true for academic skills, classroom productivity, school adjustment, and attendance. PICS can track these changes with serial administrations. To accomplish this, clinicians rely on their own judgment to select the entire 44-item answer form, or all sections from A to E, or pick out selected sections, such as Section A, current skills and capabilities, to track. We are convinced that in the hands of pediatric psychologists, PICS can prove invaluable to screen, to monitor, or both. Visit our website to learn more about PICS or contact us via our website. We would be delighted to provide you with additional information and offer suggestions about PICS use. Thank you.